That's fine. Now we recognize the Vice Chair of the full committee for 5 minutes.
Thank you, Mr. Chairman. Dr. Frieden, I want to be sure I heard you right. You just said to Chairman Upton that we cannot have flight restrictions because of a porous border. So do we need to worry about having an unsecure southern and northern border? Is that a big part of this problem?
I was referring to the border of the 3 countries in Africa.
You're referring
Liberia,
to that border, not our porous
Guinea,
border.
and Sierra Leone.
Mr. Wagner, would it help you all, the Border Patrol, if we secured the southern border and eliminated illegal entry?
Well, travelers coming across the southern border like the northern border, we're going to, query their information in our databases. We're going to ask them their travel history, where they're coming from, how they arrived in the country they're coming from.
Yes or no was sufficient. I need to move on. Dr. Frieden, I want to come back to you. I would remind you that week before last, when I was at the CDC, and I thank you for letting me come down to follow up with you all on some of our committee work, that I recommended a quarantine in the affected region and hold people there. And I still think that that is something that we should consider. Quarantine people for 21 days before they leave that region. It helps every country. I want to go back to an issue that you and I talked about at the CDC in a subsequent phone call, and that is the medical waste. And you assured me that standard protocols were being followed for disposal of this waste. And we know that 25 years ago, hospitals could incinerate their waste. EPA regulations now prohibit that, and the waste has to be trucked. And they outsource the care of this medical waste, and it results in that going to central processing centers. So, let me ask you this. Is Ebola waste as contagious as a patient with Ebola?
Ebola waste or waste from Ebola patients can be readily decontaminated. The virus itself is not particularly hardy. It's killed by bleach, by autoclaving, by a variety of chemicals.
Okay. Is Ebola medical waste more dangerous than other medical waste?
The severity of Ebola infection is higher, so you want to be certain when you're getting rid of it that you handle it.
Is the CDC assessing the capabilities of hospital to manage the medical waste of Ebola patients, and does the CDC allow off-site disposal of Ebola medical waste?
My understanding is that the latter question, yes, we've worked very closely with both the Department of Transportation as well as the commercial waste management companies to ensure that capability.
So we have an added danger in having to truck this waste and move it to facilities. Are the employees at the processing centers being trained in how to dispose of Ebola waste?
We have detailed guidelines for the disposal of medical waste from care of Ebola patients.
All right. You and I talked a little bit about my troops from Fort Campbell that are going to be over there, and I have some questions from some of my constituents. Are the American troops going to come in contact with any Ebola patients or with those exposed to Ebola or included in any of these controlled movement groups?
As I understand it from the Department of Defense, their plans do not include any care for patients with Ebola or any direct contact with patients with Ebola. Okay. That said, we would always be careful in country because there is the possibility of coming in contact with someone with symptoms and being exposed to their body fluids, and that's why the Department of Defense is being extremely careful to avoid that possibility.
We're still going to rely on self-reporting?
No. We're taking temperatures at many locations within the country. We are having hand-washing stations as a mandatory for entry.
So you're moving away from self-reporting? Because originally it was, you said our structure was built on self-reporting when I visited with you earlier. And I found a quote from you from December 2011 at the George Comstock Lecture in TB Research. And I'm quoting you. Hippocrates was right. Patients lie. About a third of patients don't take medication as prescribed, and a third don't take them at all. You can either delude yourself and think that patients are taking their medications or not. In TB control, it's a simple model. If we see people take their meds, we believe they took their meds. Now, Dr. Frieden, relying on self-reporting and making certain that people tell us the truth before they leave, and then that we catch the fever at the right time if they have a temperature. We've got to do better than this. We can do better than this. We are here to work with you, and we expect a better outcome. I yield back.
Gentlelady's time has expired now.